Have you ever wondered if something as natural as an orgasm could actually help protect your health? What if I told you that science suggests your body's most private moments might play a role in preventing one of the most common cancers in men? Today, we're diving deep into the fascinating world of male orgasms, exploring the different types, the science behind them, and the surprising link between ejaculation frequency and prostate cancer risk. Stick around. You might just learn something that could change your life. What is an orgasm? Let's start at the beginning. What exactly is an orgasm? For men, an orgasm is a complex event involving both the body and the mind. It's not just a moment of pleasure. It's a coordinated series of muscle contractions, hormonal releases, and psychological responses. But did you know there's more than one kind of male orgasm? Let's break it down. The 6 types of male orgasms. Most people think of male orgasm as a single, predictable event, but recent research and expert insights reveal a much richer landscape. Here are 6 types of male orgasms. Ejaculatory orgasm. This is the classic orgasm most people know. It involves rhythmic contractions of the pelvic muscles leading to the release of semen. It's usually accompanied by intense pleasure and a sense of release. Dry orgasm, anejaculatory orgasm. In this type, a man experiences the sensations of orgasm without actually ejaculating. This can happen naturally through certain techniques or as a result of medical conditions. Some men learn to have dry orgasms as part of tantric or sexual health practices. Multiple orgasms. Yes, men can have multiple orgasms. While less common than in women, some men can experience several orgasms in a short period, often by learning to separate orgasm from ejaculation. Prostate-induced orgasm. Sometimes called the male G-spot orgasm, this type is achieved through stimulation of the prostate gland, either externally or internally. Many describe it as a deeper, more full-body experience. If you like what we do here, please like, comment, share, and subscribe to the channel. We really appreciate your support, and it helps us to release new content every week. Thank you for your company today. Now let's get back to our topic. Full-body orgasm. This is an orgasm that involves the entire body, not just the genitals. It's often described as waves of pleasure that spread from head to toe, sometimes achieved through breath work, meditation, or certain sexual practices. Energetic orgasm. This type doesn't always involve physical touch. Some people report experiencing orgasmic sensations through energy work, visualization, or deep emotional connection. Which type have you experienced or are curious about? Let us know in the comments below. The Science of Ejaculation. Now that we know the types, let's talk about what happens during ejaculation. Ejaculation is the process of expelling semen from the body, usually at the peak of sexual arousal. It's controlled by a complex interplay of nerves, hormones, and muscles. But ejaculation isn't just about reproduction or pleasure. Scientists have been investigating whether it might also play a role in men's long-term health, especially when it comes to prostate cancer. So, can frequent ejaculation really lower your risk of prostate cancer? Let's look at the evidence. Prostate cancer, the facts. So, what is the prostate? Before we talk about problems, let's understand what the prostate actually is. The prostate is a small, walnut-sized gland that sits just below the bladder and wraps around the urethra, the tube that carries urine out of your body. Its main job? To produce and deliver fluid that helps nourish and transport sperm. In fact, that fluid makes up a large part of semen. In younger men, the prostate usually behaves, but as you get older, especially after 40, it tends to grow, sometimes enough to squeeze the urethra and disrupt your flow. Think of it like this. The prostate is like a soft ring wrapped around a drinking straw. When it swells, the straw gets pinched. That's when you start noticing slower streams, frequent urges, and those middle-of-the-night wake-ups. Understanding how this little gland works and what makes it act up is the first step to keeping it healthy. Prostate cancer is the second most common cancer in men worldwide. According to the World Health Organization, it affects millions of men every year, especially those over 50. Risk factors include age, family history, race, and lifestyle. But what about sexual activity? That's where things get interesting. The link between ejaculation and prostate cancer risk. Several large studies have explored whether how often a man ejaculates might influence his risk of developing prostate cancer. Key study number 1, the Health Professionals Follow-Up Study, 2004. This landmark study followed nearly 30,000 men over several years. It found that men who ejaculated 21 or more times per month had a 31% lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. Key study number 2, Australian research. Involving over 2,300 men, this study found that those who ejaculated 4.6 to 7 times per week were 36% less likely to be diagnosed with prostate cancer before age 70 than those who ejaculated less than 2.3 times per week. Key study number 3, Boston University School of Public Health, 2016. This research showed that men who ejaculated 21 or more times per month at ages 20, 29, or 40, 49 had a 19% and 22% decreased risk of prostate cancer diagnosis, respectively, compared to those with lower frequencies. That's a lot of science. If you're finding this interesting, hit the like button and subscribe for more health insights. How might ejaculation protect the prostate? Scientists have proposed several theories for why frequent ejaculation might lower prostate cancer risk, flushing out carcinogens. Regular ejaculation may help clear the prostate of potentially harmful substances that could contribute to cancer. Reducing inflammation. Ejaculation might help reduce inflammation in the prostate, which is linked to cancer risk. Hormonal regulation. Sexual activity could help balance hormones that influence prostate health. But, and this is important, these are just theories. The exact biological mechanisms are still being studied. Before we continue, here's something worth knowing. If you've been feeling frustrated or even embarrassed about changes in bedroom performance, sensitivity, stamina, or desire, you're not alone, and it's not your fault. There's a 100% natural solution that's already helped thousands of men feel confident and energized again. No pills, no injections, no procedures, no surgery, no risky shortcuts. Just a simple, easy home remedy you can make at home, designed to support what researchers are now calling the manhood molecule, a key factor for arousal, blood flow, and lasting power. Find out more. There's a link in the description and in the pinned comment. Check it out. It could be the very thing you've been looking for. What do the experts say? While the studies are promising, not all experts agree on the strength of the evidence. The Mayo Clinic notes that while some research suggests a slight reduction in prostate cancer risk with higher ejaculation frequency, the evidence is not conclusive. The American Academy of Family Physicians emphasizes that high ejaculation frequency may be associated with a reduced risk, but it's not a guarantee. The American Cancer Society and other major health organizations do not currently recommend frequent ejaculation as a formal strategy for prostate cancer prevention. So, what should you actually do to protect your prostate? Prostate health, a holistic approach. Ejaculation frequency is just one piece of the puzzle. Here's what experts recommend for overall prostate health. Regular checkups. Get screened for prostate cancer as recommended by your doctor, especially if you're over 50 or have risk factors. Healthy diet. Eat plenty of fruits, vegetables, and whole grains. Limit red meat and processed foods. Exercise. Regular physical activity helps maintain a healthy weight and reduces cancer risk. Don't smoke. Smoking is linked to more aggressive prostate cancers. Know your family history. If prostate cancer runs in your family, talk to your doctor about earlier or more frequent screening. What's your biggest question about prostate health? Drop it in the comments and we'll answer in a future video. Please remember this video is for education only. It is not medical advice. Always consult with a medical professional before you take any action based on information you see here today. Always speak with a doctor before you take any action that could impact your health and well-being. That being said, let's get back to today's presentation. Myths and misconceptions. Let's bust a few myths. Myth: more sex always means better health. Fact: while frequent ejaculation may have some benefits, it's not a magic bullet. Balance is key. Myth: only older men get prostate cancer. Fact: risk increases with age, but younger men can be affected too. Myth: you can't do anything to lower your risk. Fact: lifestyle changes, regular checkups, and being informed all help. What does this mean for you? Here's the bottom line. There's growing evidence that frequent ejaculation may be linked to a lower risk of prostate cancer, but it's not a guarantee. The most important things you can do are maintain a healthy lifestyle, get regular checkups, and talk to your doctor about your individual risk. Sexual health is an important part of overall well-being. Don't be afraid to discuss it with your healthcare provider. Want to learn more about men's health? Subscribe and join our community for more science-backed tips. Let's make this a conversation. Here are a few questions for you. Did you know there were so many types of male orgasms? Have you ever talked to your doctor about prostate health? What topics would you like us to cover next? Leave your answers in the comments, and don't forget to like and share this video with someone who might find it helpful. Final thoughts. Remember, knowledge is power. Taking charge of your health starts with understanding your body and the science behind it. Thanks for watching. Don't leave your health to chance. Now, watch this video and keep building the knowledge that gives you an edge.